Great. Thank you, Will. And good afternoon, everyone. Hopefully you're in the right place. This is the Department of Housing and Community Development's implementation webinar for our Virginia Homeless Solutions Program and our Housing Opportunities for Persons with AIDS, which is our HOPA program. I have the distinct pleasure of introducing the members of our team. First, we have the Homeless and Special Needs Housing, Program Administrator team led by Will Kerner, who is our Housing Program Manager. The team is comprised of Program Administrators Tamia Bright, Ray Obahero, Darlene Watson, and Desiree Williams. Next, we have the Virginia Balance of State and Special Projects team led by Dr. Darrell Wilburn. The team is comprised of program administrators Kike Oliver, Brianna Green, Chantel Higgins, and Marshika G. Finally, we have our homeless data team, which is currently led by Andrea Ukrop, our homeless data integration program manager, and I am Ara Mendoza, and I'm the associate director of our unit. We welcome you all to introduce yourselves in the chat as well. Please include your name, organization, COC, or local planning group that you're a part of. And with that, I will pass it over to Will and the rest of the team who will guide us through the remainder of the presentation. Thank you so much.
Thank you, Ara. So just a few housekeeping tips at the start. Feel free to submit questions using the chat feature during the presentation. We will have a Q&A portion at the end as well. If there are any technical difficulties, please let us know if you cannot hear or experience any technical difficulties. And after the presentation, the PowerPoint slides will be made available to anyone who attended, and a recorded presentation will also be made available. Next slide. All right, just a quick overview of the presentation today. We will begin with an overview of the DHCD HSNH team, including our mission statement and funding. And then moving on to our HSNH guidelines, including VHSP eligible activities and grantee requirements. We will also move on to the FMR rent and rent reasonableness information, risk mitigation fund, discuss our quarterly calls, close of FY24 and the opening of FY25, our habitability standards and match requirements. We will also discuss our grant agreements, reporting requirements, performance and outcomes measures, and then we will discuss the HOPWA program and its eligible activities and trainings. We will also briefly go over CAMs and how project creation and budgets are entered, and as well as remittances. At the end, we will mention upcoming events, and then again, we'll hold a quick Q&A session at the end. Next slide. The mission of DHCD is committed to creating safe, affordable, and prosperous communities to live and work and do business in Virginia. The Homeless and Special Needs Housing Team administers a continuum of state and federally funded homeless service programs to address housing and stabilization services for individuals and families at risk of or experiencing homelessness within the Commonwealth of Virginia. And these are the four main programs that we administer. The first one is the Virginia Homeless Solutions Program, and then the Housing Opportunities for Persons with AIDS/HIV. And those are the two main programs that we will be discussing during this implementation webinar today. The Homeless and Special Needs Housing Unit also administers the Home ARP, Home American Rescue Plan, as well as the Housing Trust Fund Homeless Reduction Grant. All right, just a quick overview of the funding that we will discuss for the programs in this implementation webinar. These are both anticipated amounts as we are awaiting announcement for the federal portion of these programs. The estimated amount for the Virginia Homeless Solutions Program this year is made up of a little over $16 million. And then the estimated amounts for HOPWA being around 1.6 million for the year. And with that, I will pass it off to a program administrator, Tamia Bright.
Hi, everyone. My name is Tamia Bright, and I will be discussing the HSNH guidelines today for BHSP, HOPWA, and HTF-HRG. The Virginia Homeless Solution Programs. The goals of the VHSP are to assist households experiencing homelessness to quickly regain stability in permanent housing and to prevent households from becoming homeless. These activities are designed to reduce the overall length of homelessness in the community, the number of households becoming homeless, and the overall rate of formerly homeless households returning to homelessness. VHSP eligible activities. The eligible activities are outreach to unsheltered homeless individuals and families, centralized or coordinated assessment entry system, targeted prevention, emergency shelter operations, rapid rehousing, which includes the set-asides for veterans, COC planning, HMIS, and administrative costs. And for more information can be found on page 23 of the HSNH funding guidelines for 24-26. Next slide, please. VHSP prohibited and ineligible activities. Ineligible activities under HSNH include, but are not limited to, payment for for project participant debt, including credit card bills, construction of rehabilitation of a property, vehicle repair, home furnishings, storage units, pet care, renter's insurance, work or educational related materials, cash or gift cards, third-party security deposits, housekeeping and household supplies, medical or dental care and medicines, and that's not including for HOPWA. Please refer to the HSNH funding guidelines 24-26 for more information on prohibited and ineligible activities. If you're unsure if an activity is eligible, contact your program administrator prior to incurring the expense. Project participant eligibility. I'm sorry, next slide, please. So our project participant eligibility, emergency shelter, program participant eligibility is literally homeless, at imminent risk of homelessness, or individuals exiting institutions where they reside temporarily with no resources or anywhere to go. For rapid rehousing, literal homelessness, shelter residents living in other situations not meant for human habitation, or individuals who were literally homeless prior to entering an institution where they resided temporarily for 90 days or less and are exiting the institution with no resources or anywhere to go and no other resources. And then targeted prevention. All at imminent risk of homelessness and household income between 30% AMI, and they also have no other resources. So you also want to see page 26 of the guidelines for a copy of this table. Next slide, please. Grantee requirements. Housing first. Case management best practices. We'll make sure you have harm reduction, trauma-informed care, proof of diversion, equal access and prohibited inquiries, compliance with fair housing and civil rights laws, and prohibition against involuntary family separation. I always say that. Next slide, please. Housing first. Flexible and adaptable service model. Housing First is a flexible and adaptable service model that addresses homelessness by quickly pacing individuals and families with children experiencing homelessness into housing without any preconditions or barriers. Voluntary services are offered to meet the individual's needs. Next slide, please. Grantee required documentation. Required documentation from the project participants should be minimized to help reduce barriers to entering the HSNH programs. Case managers should work with project participants to secure documentation for entering housing as required by landlords. HSNH program documentation includes initial intake and standardized assessment tool, proof of diversion, proof of connection to resources, VHSP rapid rehousing, and prevention project participant eligible requirements form. See page 26 of the guidelines for project participant initial eligibility by activity type. Also refer to project-specific sections of the guidelines for unique requirements for each project type. These items here are not required for project participants to access HSNH programs. So this is the list, some of it. Eviction notice, income, employment, a valid photo ID, credit score, social security card, sobriety or proof of enrollment in treatment, pay stubs, and/or bank statements. Please also note, grantees are prohibited from inquiring about an applicant's or participant's sexual orientation or gender identity for the purposes of determining eligibility or otherwise making housing available. This does not prohibit an individual from voluntarily self-identifying sexual orientation or gender identity. You can read more about the equal access and prohibited inquiries on page 7 of the guidelines. Next slide, please. So we're going to talk about proof of diversion. Diversion conversations should be made during the participant's initial assessment. All providers must engage households seeking homelessness assistance in a problem-solving conversation to address the household's current housing crisis. This should include a discussion of alternative resources available to the household, linkages to the mainstream and natural supports, and light touch assistance. Case notes need to be present, clearly documenting all attempts to divert the household from homelessness. Each CLC LPG needs to ensure that all partners receive the attempted diversion documentation when individuals and families enter the shelter. Next slide, please. Let's talk about case management best practices. Case management is required at least once a month for participants receiving financial assistance. Documentation of monthly case management must be in the client file. This case management includes, but is not limited to, conducting assessments, facilitating access to mainstream resources, monitoring and evaluating program participant progress, developing and follow up on individualized housing and service plans, and coordinating with and referring to other providers. Next slide, please. Voluntary supportive services. Supportive services individualized to your client's needs should be offered through their contact with providers. While case management is required at least monthly, supportive services may not be required for program participant or as a condition of program enrollment. Supportive services are important tools to help households stabilize their living situation and address necessary needs for long-term stability. Examples of supportive services include, but are also not limited to, financial counseling, mental health services, substance use disorder and supports, childcare, education, and career services. So if you have any more questions regarding voluntary supportive services, please reach out to your program administrator for further guidance. Next slide, please. Compliance with fair housing and civil rights laws. Grantees must comply with all applicable state and federal fair housing and civil rights requirements. This includes the Virginia Values Act, effective July 1st, 2020, which expands the list of protected classes under the Fair Housing Act. As expanded, the Virginia Housing Act prohibits discrimination based on color, race, religion, national origin, sex, elderliness, age 55 and older, familial status, disability, source of funds, sexual orientation, gender identity, or military status, collectively the protected classes. So also you can read more about non-discrimination and equal opportunity requirements in affirmatively furthering fair housing on page 15 of the guidelines. So let's talk about the definition of family. Equal access to housing in HUD and DHCD programs regardless of sexual orientation or gender identity. Family includes, but is not limited to, regardless of marital status, actual or perceived sexual orientation, or gender identity, any group or persons presenting for assistance together with or without children, and irrespective of age, relationship, or whether or not a member of the household has a disability. A child who is temporarily away from the home because of placement in foster care is considered a member of the family. Prohibition against involuntary family separation. The age of a minor child must not be used to deny any family's admissions to emergency shelter. The family unit must be accepted in shelter as they present. So also you can see page 21 of the guidelines for prohibition against involuntary family separation. And now I'm going to pass it on to Desiree Williams to talk about fair market rent and rent reasonableness.
Good afternoon, everyone. We're going to jump into one of our favorite topics, fair market rent and rent reasonableness. When households are moved into a new unit or stabilized into an existing unit, the rent must follow the appropriate standards. Rent reasonableness and fair market rent. Rent reasonableness means that the rent must be equal to or less than similar units in the area. And fair market rent should include, or if it is including utilities, should be at or below the HUD established FMR for the unit size in the area. These forms must be completed and included in all housing participant files. And please note that the FMR waiver in place only applies to state-funded projects. Next slide, please. Risk mitigation is eligible under state rapid rehousing. This category seeks to improve outreach and engagement between grantees, participants, and landlords. And eligible expenses include repair to damages that are not covered by the security deposit and up to 2 months of rent or until the vacancy is filled, whichever comes first in situations where a tenant has left before the end of the lease. Both eligible expense types are offered as a last resort to maintain landlord relationships and encourage the continued reduction of rental barriers. Any payment of risk mitigation funds must be counted toward the project participants' 24 months of assistance limits. Next slide, please. Quarterly clause. We will hold a quarterly call each quarter discussing how the COC is using data to make decisions, review your expenditure rates for VHSP and Housing Trust Fund, discuss trends and any future plans or any concerns that the community may be facing. Next slide, please. All right, as we are ending close out for some of us, please make sure that the actual match for fiscal year 2024 has been uploaded. This is for the lead agency only. If you have not already submitted your financial audit, please make sure you have uploaded that. Your signed grant agreement or amendment, and this is for any grantee who has deallocated funds or accepted any reallocation funds. Your year-end report and your June actual. And just as a reminder, June actuals are due today if you have not submitted them. Next slide, please. All right, for 2025 startup, any emergency shelter operator or grantee, please make sure you have uploaded a habitability standards form for each of the shelter locations that you utilize. Your proposed match form for the lead agency only. Again, your financial audit, again, if you have not uploaded that, signed grant agreement, your budget revision, and then the COC/LPG grant agreement. Next slide, please. Basic habitability standards must be completed for all ESO providers and permanent housing participant files. For ESO providers, this form should be completed for each shelter location you utilize and upload it into CAMS. And please keep a copy on file. Next slide, please. The 25% match is required based on the total amount of funds allocated to your local COC or planning group. It must be met at the community or grantee level. Allowable sources of match are cash, fair rental value of any donated material or space, and salary paid from any local or private sources which have not been otherwise charged to VHSP. Next slide. Your grant agreements are applicable from July 1 to June 30th of 2025. Expenditures will begin on July 1, and please ensure that all of your payroll expenses, i.e. pay periods, reflect the start date of July 1 on the remittance. You will have a lead agreement for COCs, and then, of course, all grantees will receive a VHSP grant agreement identified on the year 1 request. And next slide. Okay, and I'm passing off to Andrea, our data support manager.
Thank you, Desiree. So I just wanted to quickly go over some of our reporting requirements. These will not change to our knowledge for FY25. And we will continue to use the COC APR for reporting out for your VHSP. For each activity, coordinated entry, you'll use the coordinated entry COC APR. Then for outreach, emergency shelter, rapid rehousing, and any of the any other reports for Housing Trust Fund, those will all come out of the COC APR following the instructions we had provided mid-year. Additionally, we may request emergency shelter reporting on capacity and utilization. This is a report that has been required in the past, but I believe it's been a couple of years since we required that, and we might be circling back around for that reporting. And additionally, the length of financial assistance and case management services for rapid rehousing may be something that we also request at year end. So make sure you are tracking your information so that you would be able to complete those reports as well as the information that comes out of the COC APR. Additionally, just like in the most recent years, if you receive ESG rapid rehousing, you will need to submit an ESG CAPER report, and that is via Sage, as many of you have done recently. If you have questions when it comes to reporting, I would be the contact person for those questions. Next slide. Reporting due dates, we have grantee level reports that are due 2 times a year, and those do get submitted into CAMS. The late reports, if we do give extensions for extenuating circumstances, but at some point reports have to be submitted in order for us to meet our own internal and external deadlines. So once you have passed all deadlines that have been given, remittances reimbursement will be held if reports are not submitted and corrected timely. You will report for mid-year, and that will be from July 1st to December 31st, and those will be due June 10th of 2025. And then again, you'll have an end-of-year report that is for the full year from July 1 to June 30th, and that will be due July 10th of 2025. Next slide. I spoke to the ESG CAPER. This is only for federal rapid rehousing. These are due annually. Make sure, especially if you are a victim service provider, that your comparable system is able to provide the CAPER in the CSV format that is required. And if you need multiple uploads for Sage, that is something that needs to get communicated to me at project setup. So in the past, we've had agencies who separated funding into families and individuals. If that's the case, then we need to make sure we put that in our system correctly so you get to Sage uploads. So just make sure we have that information. And if you have any questions regarding that, please let me know sooner than later. And the next slide. The other thing, when we did scoring this year, we took HUD system performance measures into account, and we have been doing this for a couple of years. We will expect to continue to do that during funding application cycles. The system performance that we look at most include length of time homeless. We look at that from the time somebody enters the homeless system until someone exits a homeless program. First time homeless, so those who have not been in the HMIS system in a given period of time. Returns to homeless, we have started looking at that at an annual rate as opposed to looking to 2 years out. We're looking at those returning to homelessness within 1 year. And then looking at trends over time, we use the point in time count and as well as the annual homeless count. So these are measures that we use and aggregate for the state to look at the state's overall performance, as well as using those to look at COC's performance for application purposes. And with that, I believe I'm turning it over to G to discuss HOPWA.
Yes, good afternoon, everyone. So the Housing Opportunities for Persons with AIDS HOPWA program was authorized by the National Affordable Housing Act in 1990 and was revised under the Housing and Community Development Act of 1992 to provide states and localities with the resources and incentives to devise and implement long-term comprehensive strategies for meeting the housing needs of low-income persons with acquired immunodeficiency syndrome, or AIDS, and related diseases and their families. Activities of primary importance are providing housing assistance and services that assist with populations that help to maintain housing stability, where they can maintain complex medication regimens and address HIV/AIDS related problems. For more information on HOPWA, you can find this information on page 42 of the guidelines. Next slide, please. Okay, so for our HOPWA activities, and these are HOPWA-funded activities that will support direct housing assistance and support services to those most in need for HOPWA-eligible individuals. These activities do include tenant-based rental assistance, or TBRA, short-term rent, mortgage, and utility assistance, or STRIMU, supportive services, permanent housing placement, housing information services, but up to 3%, as well as administrative costs that are limited up to 7%. Next slide. And so for the eligibility for the HOPWA program, households have to have at least one person with the AIDS or related disease, HIV infection. This includes individuals whose households where the only eligible person is a minor. Medical verification of status is required at the time of eligibility intake. The household also must be at or below 80% of the area median income, or AMI. And income limits are available on the HUD website, and grantees should use the HUD Section 8 income eligibility standards for HOPWA when doing eligibility of intakes. Next slide. Just to touch bases on the HOPWA reports. So the APR, which is due today, which most of the HOPWA providers would know, those are due today, and that information does consist of leveraging information as well as performance measures. It goes over barriers, trends, and unmet needs, as well as the beneficiaries. Next slide. And also to talk about a few of the trainings, please make sure that you document that you have completed these required trainings and have access to the certifications for completion. And so listed is the HOPWA oversight training, the Getting to Work, a training curriculum for HIV/AIDS service providers and housing providers, and the lead safe housing rule training. These are all links that are accessible to complete these trainings, but the HOPWA financial management training course It is still in process with HUD, so we don't have access to that. But we will be sharing more information as it becomes available. Next slide. And so just to touch base on HOPA remittances, we will be going into detail about remittances later down in this presentation. But for my HOPA providers, please understand that the remittances that we receive are different from VHSP and Housing Trust Fund remittances. So if you have any questions, you may reach out to myself, the HOPA program administrator, for any support with this. And also, just before I let you guys know, we will be having our quarterly meeting where we will dive into more specified HOPA related content. And so so stay tuned for that information. Thank you. Next slide. So I'm going to
Thank you.
pass it on over.
Thank you so much, Marshika.
Yes.
Marshika is our new HOPA program administrator. And my name is Ray, if y'all don't know, just in case. But I will be talking about CAMS. CAMS, everyone's favorite part. So if it did not happen in CAMS, it did not happen. And that is similar to what they tell us as direct service providers. If it didn't happen in the case notes, didn't happen. So let's talk about CAMS. You'll notice that this is what CAMS looks like. And your project, we have created the VHSP projects. However, when you click on the project, VHSP 2425, you want to make sure that all of this information is correct. So that includes every box here, the project primary contact. Here we've got, also, you want to include the project location and the primary service area. The primary service area is important because so many of y'all are in multiple COCs. So just please make sure to fill out each section of the project profile. Next slide, please. So, yep, and here is the slide talking a little bit about the applicable primary service areas. Next slide, please. So once all of the information is updated, everything is correct, you are going to want to hit save down there at the bottom. This is important because it is very easy to put all of the information in there, but then click out another tab and not save. All of your hard work will be gone. So please make sure to hit that save button right there. Next slide, please. Grant agreements. So you are most likely familiar with the tabs in your CAMS profile. We were looking at project information, but there are other tabs, as you'll see: project budget, remittances, and reports and communication, or reports and documents. You'll notice that the VHSP grant agreements are already uploaded for you. That's VHSP 2425. You can find them in the reports and communications or reports and documents tab as listed right there. Next slide, please. So when you click on the grant agreement, it's going to get you to this page right here. You will need to click on that link that is bolded, VHSP grant agreement 2015 final test.pdf. You're going to click it, download it, and then print it off for the agency's director's signature. As a note, please remember that we accept wet signatures, so handwritten, or digital signatures, and those have confirmed timestamps. We unfortunately cannot accept typed signatures. So that is how you access the grant agreement. Next slide, please. Yep, same thing here. So in that same tab, reports and documents, once you download it, get it signed by the needed party, you can scan it. Make sure that you scan both sides, all pages of the grant agreement are there. And then once that's in there, you can go ahead and upload it in that slot right there. Most of y'all are familiar with this. Next slide, please. And then the HSNH team will finalize signatures with DHCD. So some of y'all may have noticed that in the past, we would get it signed first by our needed parties here at DHCD, and then we would send it to you for signatures. That's just flip-flopped, not a big change, but we will finalize the grant agreements. We'll download it after you've uploaded it in CAMS. We'll get it signed on our end, and then it is our responsibility to get the fully executed grant agreements in your CAMS profiles. Next slide, please. All right, so I'm going to be talking about a little bit of the other tabs. And I know that we've been here a long time. Please bear with me with this. But I also just wanted to let y'all know that there is a CAMS user guide. Our most recent version of the CAMS user guide is the 2021. I know, a little bit outdated, but none of the CAMS information has changed. So feel free to use that CAMS user guide from 2021. I have it printed out with me, next to me at all times. But let's talk about the project budget tab. So this is what your project budget looks like. Can we go to the next slide, please? Thanks, Brianna. For the project budget, in that top box right there, you're going to enter the grant award total in that top box. Next slide, please. All right. And then after you enter the grant award total in that top left box, you are going to go through each category and include the funding of which you were allotted for. And the way that you do this is, if it's difficult to see, we'll also send these out afterwards. But under each category, you're going to hit that add button, and you'll see that, well, hopefully you can see those subcategories. So the subcategories as shown are the essential services, case management, essential services, limited support services, and other. So when folks enter the funding in the category of which they were funded for, please drop down each subcategory. For that first category, you're going to drop down those three, even other. Even if you don't think you're going to touch other, please drop down that other line item subcategory. Next slide, please. And here we've got a better example of dropping down the subcategories. So just important to note, please remember to drop down each subcategory. If you are not funded for a certain category or subcategory of which, there's a drop-down box, you may enter 0.00. Next slide, please. And it is important to note, unfortunately, you must repeat the add and select process for each subcategory. No, there is not one button that just, drops all the subcategories for us. So just, take your time, go line by line, make sure it matches the grant agreement uploaded in CAMS. Next slide, please. Oh, and this is just a note, we will have to deny the budget if each line item is not dropped down. For example, if you forget to drop down other, or maybe, you did not put anything for COC planning because you were not funded in COC planning, we will still deny that budget and ask that you put in 0.00 for COC planning and all the subcategories underneath it. Next slide, please. And then same thing here. So CAMS will not automatically save your work, as you've kind of noticed from me talking you through this. But once you enter in all the subcategories and all the categories, everything that you're not funded for has a 0.00, you're going to hit save. It's very important to hit save because your work will not save otherwise. Once you hit save, you can do request budget revision. You cannot request the budget revision without first hitting save. Next slide, please. And so that is it for the budget. Once your budget, is fully approved, then you may begin submitting remittances. And I will say that we probably get the most questions just about remittances. So I'm happy to walk through those on the next slide. All right, so we're looking at the remittance tab now. We're going to enter the new remittance the same way you've been doing it. Go ahead, click that button. Next slide, please. And it'll look like this. It looks very similar to the budget page. So when you enter your remittance, you're going to put in the information under the DHCD request column. So that'll be the amount of which you are requesting. And please ensure that the amount you're submitting for DHCD request reimbursement matches the amount on your remittance cover sheet. You're gonna upload first you're gonna submit the DHCD request. So you're gonna type it into there, hit save down there at the bottom, and then submit remittance request. Next slide, please. Actually, could you go back a slide, Brianna? I'm sorry. So another thing I wanted to note right here before I talk about the next one is after you enter the DHCD request in CAMS, you are going to upload the remittance form itself right here. that choose file section. And it is important to ensure that your DHCD request amount matches the cover sheet amount on your remittance spreadsheet. Unfortunately, a discrepancy, even of 1 penny, we will have to return just to verify. We want to make sure you get reimbursed for the full amount. So just ensure those match, and then go ahead and hit submit, and we can go to the next slide. Thanks, Brianna. So requirements for remittances. Remittances are requests for reimbursements, and these are submitted in CAMS. Any remittance that does not go through CAMS does not get reimbursed. If you email a remittance, that will not get reimbursed. So make sure it goes in CAMS. Reimbursements are also based on the date the payment is made by the grantee. You'll notice if you were a VHSP 2324 provider that we switched to monthly remittances. That will be the same, and monthly is based on the date of the payment. So if you are paying August rent, but it has a payment date of July, that is a July expense. Remittances may be submitted for reimbursement the month following the actual expense. So expenses paid for during the month of September can be submitted anytime in October, but that cannot work in reverse. Let's say, so I just gave an example of, let's say we paid October rent in September. We cannot flip that, and we cannot have a September expense on an October remittance. Or we cannot have an October expense on a September remittance because October was made in the future. If it has an October payment date, it needs to be on an October remittance or after October. It cannot be before October. Remittances should be submitted monthly or as communicated by your program admin. Allow up to 30 days for payment to be issued. And your PA can tell you more about the approval process if you have any questions about that. And veteran-related line items are to be used when you're providing financial assistance or stabilization assistance for veterans. Next slide, please. So some common errors for remittances. I will also just put this out there that I created a VHSP remittance cheat sheet, and it is an example of exactly how to do a remittance. I did not want to overload you with information, so we have that just as an additional resource should you request it. I think it's helpful, so feel free to request it. But here are some common errors for why remittances get denied. We see this very often. Oftentimes it'll be missing information. So check numbers, dates, staff positions. Each column on that remittance spreadsheet will need to be completed. Anything missing, the PA will have to reach out to you just to confirm or get that additional information. As I've noticed with the grant agreements, or as I've noted about that, we cannot accept typed signatures. That's for the grant agreements or remittances. So please ensure remittance signatures are wet, and that means handwritten, or it is digitally signed with a timestamp. Some folks have very beautiful handwritten signatures that look like it's typed. So sometimes we just need to confirm, but that is more just, letting you know that we're just confirming. Yes, well, I'll let the team reply to you, Lisa, but I'll keep going. Amounts on the cover sheet do not match the CAMS request. So that is what I talked about earlier. Just when you go to the DHCD request in CAMS, you want to make sure it matches your cover amount on the spreadsheet. Even discrepancies of 1 penny, we will have to reach back out to you and confirm. And another common error for remittances, there's an error in the amount. This is not an exhaustive list. These are just the most common ones that we've noticed as a trend in the last year. So please feel free to work with your PA. And I know that it's a lot of information, right? So don't feel free to use the CAMS user guide. Don't hesitate to reach out to us with the cheat sheet. All this info is ready for you. Next slide, please. HSNH pre-approval process. So we thought we should kind of speak a little bit more about the HSNH pre-approval process for this year. Expenses such as limited supportive services and anything designated as other require pre-approval from DHCD prior to utilizing VHSP funding. What this means, Email your program administrator with a pre-approval request prior to incurring the expense. If you incur the expense and then ask for pre-approval, but then find it is not eligible, unfortunately, you will have to use private funding or another source of funding to cover that expense. So it is very important to request pre-approval prior to incurring the expense. Yeah, and what happens when you request the expense? The PAs, we will review the request. We might need additional information to approve or deny it. You will receive an email approving or denying the request from your program administrator. And then upon approval, you may move forward with the activity or expense. Include information that there was a pre-approval in the notes section of your CAMS remittance submission. If you do not include that note that you were pre-approved, your PA will have to go back after the remittance and include it afterwards. So it just saves everyone time if you add the note yourself. And something very important to note, which might be a change folks are not just, which might be a change. Please note that pre-approvals for VHSP, any HSNH funding are granted for your current grant period. Approvals for VHSP 23-24 do not automatically roll over to VHSP 24-25. Approvals are not automatically rolling over, and you will need to request pre-approval for expenses under limited supportive services and any other expenses with your PA prior to incurring the expense. And I believe that is all that I have for y'all. And again, we've got many resources for you, and I'm going to hand it off to Aura.
Thanks, Ray. So as follow-up to communication that our team sent out earlier today, at this time, DHCD has not received the grant agreement to support the federal rapid rehousing portion of the HSNH Virginia Homeless Solutions Program. In an effort to ensure that there is no further delay in the delivery of services in your communities, our team plans to deploy the state funding to support projects first. So what this means: grantees will receive a grant agreement that outlines the funding that will be available for their state-funded activities. So that includes coordinated entry, targeted prevention, outreach, emergency shelter operations, state rapid rehousing, COC planning, HMIS, and admin. For grantees receiving federal rapid rehousing, grantees will receive an amendment that will outline the federal rapid rehousing portion of the rapid rehousing award. We will allow grantees to begin spending out of their state rapid rehousing funds upon the receipt of the grant agreement. And once the funding is available, grantees receiving federal rapid rehousing funds will be required to transition from spending the state portion towards spending the federal portion of their rapid rehousing funds. Grantees utilizing the FMR waiver will be allowed to continue to use the state rapid rehousing funds for those households using the waiver. So we understand that this is a bit of a change. We will hold questions about this shift and other matters that were outlined in this presentation for the end during that Q&A section, but I just wanted to say that we understand that this is different than our operations in previous years, and we're here as your partners to support the implementation of your programs. Our goal is to be responsive to the need in the communities. So please don't hesitate to lean on us for guidance and support as y'all are implementing your projects. This slide just outlines the information that you can find on our website, including our most recent guidelines and program forms that organizations should be using during the implementation of their projects. And then this is just some information about important events that are coming up. This year, we will be holding our annual COC and local planning group meeting in person during the Governor's Housing Conference. So the meeting will be held on November 13th from 9:30 a.m. to 1 p.m. And details about the room for where we're going to be holding the meeting will be provided at a later date. And of course, the Governor's Housing Conference will be held in Virginia Beach this year at the Convention Center. And this is the information for the address of the Convention Center and a link to the website. But just so y'all know, and you can hold on your calendars, that the conference will be held from November 13th to November 15th. All right, this slide is basically just an outline of the program administrators and the regions that they cover. So this is just to give you a high level overview of, the program administrators and the different regions that they cover across the Commonwealth. Y'all should have this information, but we wanted to include this just in case you needed this information for your program implementation. And finally, here is the contact information for our entire team. This may look a little small on your screen, but we will be sharing the slides after this presentation, so you will be able to access this information once we end our webinar today. And that is the end of our formal slides, so we can move into our question and answer portion of our presentation. But again, I just wanted to reiterate, thank you all so much for your participation in this webinar and just always being considerate partners as we're going through our project implementation. So thank you guys again.
There was one question that came through the chat pretty early on in the webinar. Is proof of diversion required for clients in a DV shelter who are there due to imminent danger? Those clients do not enter shelter via the centralized intake. Proof of diversion is still required for clients in a DV shelter. If that diversionary conversation is not happening at central intake, just whatever their first point of access is going to be, just documenting that they've had that conversation with that client. All right, I see some hands raised. Let's see. Chris, do you have a question?
Yes, this is Chris from Culpeper Housing and Shelter Services in the Culpeper area, Virginia area. My question is that I know you went over the VHSP state funding. My question would be, when it comes to prevention, since we didn't receive the HUD contract or those things to give us the information and go there forward, are we supposed to receive something soon, or do we halt our prevention? Because since we haven't received anything. So I'm just trying to figure out what, since this is new to me and I was new to you all, just the direction of where you want us to go forward.
Will, I can take this if you'd like.
Sure.
So hi, Chris.
Hey,
thank you for your question. So actually, targeted prevention is included in our state funding. It's not actually covered by our HUD grant agreements. The only activity that's impacted by the fact that we don't have our grant agreements is the federal rapid rehousing portion. Hopefully that makes sense, but it does mean that you can start your targeted prevention projects when you receive your grant agreements from us. Does that make sense?
Yes, I appreciate it. Thank you.
No problem.
All right, just switching over to the chat, I see a couple questions coming through there. Which guidelines apply or don't apply to Housing Trust Fund fundings for UPIP projects? The UPIP projects under Housing Trust Fund Homeless Reduction Grant have their own separate guidelines that is at the end of the large HSNH guidelines document. And we can send that out to you all after this webinar. If you would like to contact your program administrator, they'll be able to direct you to those guidelines and kind of where the UPIP guidelines are within it.
It also looks like Laura Pennycuff has her hand raised.
Yeah, hi. I had two questions. One, is there a form that we need to be using for proof of diversion? This is the first time we've had our DV shelter in this funding, and we were already a month in, and so people have come and gone through shelter that we haven't had this form for. So if there's something we need to be using, we need to get it ASAP. Is that something we should ask Darlene for?
There is not a set form that we have to document diversion. So like a lot of folks will use their coordinated entry documentation to do that. But I understand that for you all, folks aren't coming through central intake. Um, so whatever sort of document you all do during your initial intake, if there could just be a spot there saying that, like, yes, we've had this diversionary conversation with the client, also noting it just in case notes that a diversionary conversation happened would be proof of diversion as well.
Okay, and then my second question was for the meeting that you all just announced in November. Is that something I was a little unclear? Is that for COC leads or for all like grantees?
I can take that, Will. So that's primarily for our COC leads, and they typically identify who might be the most appropriate person to include in that space as well. So you may hear from your COC lead if they feel like the topics are pertinent to you. You may not, but it is a requirement for our COC and local planning group leads.
Okay, thank you.
Hey, Will, this is Ray. It looks like there are some more questions in the chat. First one is, which guidelines apply/don't apply to HTF funding for you? I think did we address that one?
Yeah, we addressed that one.
And there's
Yeah, the next one I see, there's been an uptick on landlord use of surety bonds in order to lease units. I'm wondering if this would be considered third-party deposit or something else. It's a newer trend that's concerning as well. Could you give a little more information on these surety bonds and how they're being used in order to secure leases on units?
Hi, yes, this is Cindy Musabu from Richmond, and I'm no expert on this by any means. I just we had this instance with some private money where we were trying to figure out. We had some families that were getting approved for different units at different locations, so completely unrelated properties. That the client was saying that the landlord had said that they had to pay their deposit as a surety bond to the surety bond vendor in order to move forward. And they were saying that the surety bond, because it's a different type of method of guaranteeing that the landlord is covered if the tenant does not pay, that they can file a claim with the surety bond and then they'd get their money back, but the landlord could still evict, and that they wouldn't necessarily refund the deposit, but also in the way they were making the tenant believe that they had to sign up and pay their deposit this way, or else they wouldn't be able to move forward with their unit. And so we sort of had to do a crash course on surety bonds and how they're functioning, but also make sure that the tenant who was insistent on, going to this property and they wanted to get in and they understood the ramifications. And we ended up kind of giving them an info sheet about surety bonds just so that they knew sort of what their rights were, because it doesn't seem very tenant protected. But at the same time, they didn't present another option to pay the deposit. So they didn't really have a choice. And so it was a property that's sort of under the microscope out of state, but in Virginia, not necessarily being enforced. And so I'm like, but it wasn't the only type of property that was doing it. And I see that it's sort of a new trend. And I'm just curious about like how, as a housing community, we'll navigate those when they become more mainstream. But also, I wasn't sure if someone had already tackled this issue. And if so, I'd love to know how, and if it's considered a third party vendor, which kind of it is, like in theory, logistically it is. But we had to pay it privately. But still, I just was curious about what people were seeing on the front of that. And of course, I'm sure these funds won't be eligible, which will start to limit options for families, I think, down the road if more landlords take this on as a way to guarantee their own money, but come after the tenant through the surety bond company if they default.
Thank you for providing like that background information. And based on what you described, it's similar to third-party deposits that we had seen in previous years. And just based on that, I believe would be ineligible based on our current program guidelines. But if you could send just like this information to your program administrator so that we can talk about this internally, because I want to make sure that we're also having like strategic conversations on how we deal with this growth, like how we deal with this issue going forward if we see that it's a trend that's likely to stick around and continue impacting communities.
Yep, I'll send you what I have. Thank you so much.
Thank you.
I see a question regarding the Hopwick caper to replace the former end of year report. So yes, previous to last year, there was end of year reports that were in CAMS for Hopwa. We now have the upload report, the Hopwick caper, and the upload. Or, I'm sorry, not the upload, the spreadsheet that gets uploaded to CAMS. So there are no other reports for Hopwa. It is the fun-filled spreadsheet that everybody has done last year and this year.
Hey, Will.
Hey, is this Cicely?
Yes, it is.
Hi, Cicely.
How are you?
Good. How are you?
I'm good. So, I asked a question in the chat. I don't know if you saw it yet, but I'm specifically asking around, will there be any advocacy around the current ineligible costs against DHSP and Housing Trust Fund or supportive services that actually align with HUD's COC eligible activities or supportive services?
Will, I can take this one if you'd like.
Sure.
So hello, Cicely. Thank you for your question. So really, our goal is to just better understand what's like ineligible and eligible and making sure that it's reflective to meet the community's needs. So we're taking this input all the time. And what I will say is that there will be input sessions where we may discuss eligible activities, eligible expenses that may come down the line. So while they may not be eligible at this time, you know, as was stated in the presentation, like please speak with your program administrator. We will also open up space for communities to advocate for what is needed in their programs and to meet the unique needs of their clients. So while it may not be eligible in this iteration, just because I'm sure that y'all know, but the process to update our guidelines is multi-level and multifaceted. So in order for us to deploy the funds quickly, we didn't make large changes this year, but we will be considering that for future iterations. Does that make sense?
Yes, that makes sense. I guess I have questions around like the timeline of that because I've been, Will knows this is a question that I bring up to Will on a regular basis. And Darlene is going to hear it a lot lately too, but I just think we really, times have changed a lot since we started this kind of work in these spaces. And we really are not able to kind of focus on the housing first model without really being able to address some of the other barriers that supportive services actually is able to address. And so I think I don't know when the next iterations will occur. I don't know when we will have those opportunities to speak and provide input in those spaces. But I do think that we need to start looking at that sooner rather than later.
And we appreciate this feedback. And obviously, when the time comes when we're collecting input for our guidelines to make changes, that will be communicated through your program administrator. as well as just events where we will be holding potentially some in-person events, space for this kind of input. So we do encourage our partners to, speak directly with us at those events, participate, lend your voices. And I will say, I do want to be completely transparent, which y'all know. COC funding, HUD funding, even state funding that is dedicated for individuals who are experiencing homelessness is very finite, right? So we also have to work with our partners to make sure that they understand, where they can step forward and potentially support some of these supportive services needs that our funding may not be able to support, again, just because it's so finite. So that's all that to say is, we will always open space for our partners to, provide feedback, provide input, and we can leverage this information with our other state agency partners to make sure that they understand what the dire need is in the community.
So I see another question, and it's, can DHCD make a decision sooner rather than later about what reports will be required at mid-year? At mid-year, the report will be a report from July 1 to December 31st. And all of that information will be pulled from either the coordinated entry APR or the COC APR. The additional reports that I spoke about are end of year reports that we may bring back. One of them is for capacity of shelter and utilization, and that takes and the math for that is the number of shelter nights, beds that were available. So you're multiplying your beds by the number of days, and then your capacity is, your utilization is the number of people that were in those beds with that same calculation. The one for rapid rehousing and prevention, looking at length of time of services, supportive services versus financial assistance. I know that that might be something that you are getting, that you're doing on the side. But I will say there is a good chance that we're going to ask for that information. It's something that there are some plans to look at some new data points as my team gets built out, and looking at how long case management is taking place and how long financial assistance is taking place in terms of outcomes. In relation to outcomes is something that we will be looking at, and it's something that we've looked at in the past. So I'm giving you heads up that there's a good chance those will be required at end of year, but those will not be required at mid-year. And they are both reports that up until, I believe, last year or the year before, they had been required. So I hope that answers your question.
So there may be some responses in the chat, but I will take Sean T's question. So in regards to additional information about diversion, I would recommend that you follow up with your program administrator to schedule some technical assistance. We can also look into like other resources, such as like information from the National Alliance to End Homelessness, information regarding diversion, and share that with you. But I think the first step is to reach out to your program administrator to schedule that out. I just want to make sure that we hit everything. So if anyone from the team sees questions that we have not responded to, can either y'all come off mute or just redrop it in the chat. I'm just trying to follow what is in our chat right now.
Looking through the chat, Aura, I think we've answered all the questions that were submitted.
Great. Well, I don't have a joke to end our webinar on, but we can end the recording. Thank you all so much for participating today. We, again, just appreciate your partnership. We're just going to end the recording. Our team will stay on.